We'll finish the series by pulling the biggest thread of all together. Across these episodes, one idea kept returning: the most powerful treatments target the specific molecular flaw driving a cancer, not just the organ it grew in. That's precision oncology, and it's quietly rewriting how cancer is diagnosed and treated. Let's see where it's going, and how the future of catching cancer early is changing too. For all of history, cancer has been named and treated by its location: breast cancer, lung cancer, colon cancer, and the treatment followed that label. Precision oncology adds a second, deeper label: what's actually broken inside the tumor at the molecular level. We've seen this again and again in this series: the HER2 protein in breast cancer, the EGFR mutation in lung cancer, the BRAF mutation in melanoma, the abnormal protein in chronic leukemia. In each case, reading that molecular flaw pointed straight to a drug built to hit it. Precision oncology is the systematic version of that idea: sequence the tumor's DNA, find its specific drivers, and match the treatment to the biology rather than just the body part. Making this real depends on genomic testing, reading a tumor's DNA to reveal its mutations, often scanning hundreds of genes in a single test. The results can flag a targetable driver the doctor would never have guessed from the cancer's location alone. And this has led to something genuinely new in medicine: tumor-agnostic drugs. These are treatments approved not for a particular organ, but for any cancer that carries a specific molecular feature, no matter where in the body it started. If your tumor has the right marker, the drug is an option whether it's in your lung, your colon, or your thyroid. That's a profound shift. For the first time, a cancer's genetics can matter more than its address. One of the most exciting tools in this future is the liquid biopsy. Tumors constantly shed tiny fragments of their DNA into the bloodstream, and a liquid biopsy reads that circulating cancer DNA from an ordinary blood draw. Think about what that enables. Instead of a painful, sometimes risky tissue biopsy, you can profile a tumor's mutations from a vial of blood. You can repeat it easily to see whether a treatment is still working, or whether the cancer is evolving resistance, in near real time. And the most ambitious use, still being proven out, is early detection: multi-cancer blood tests that scan for the DNA of many cancers at once, aiming to catch them before symptoms ever appear. If that works reliably, it could do for many cancers what the colonoscopy did for the colon. All of this creates an ocean of data: genomic profiles, pathology slides, radiology scans, clinical records, far more than any human can fully read. And that's where artificial intelligence is increasingly stepping in, a theme our companion series on AI in drug discovery explores in depth. AI models help spot patterns in a pathologist's slides, flag tumors on a scan, sift a tumor's mutations for the ones that matter, and match patients to the clinical trials they're eligible for. The honest framing is the same one that runs through modern oncology: AI here is mostly a throughput tool. It makes the work faster and broader and more consistent, while the oncologist still frames the question and makes the call. Used well, it helps precision medicine actually scale to every patient. So here's this whole series in one line: cancer is being redefined from a disease of organs into a disease of molecules, one we're learning to catch earlier and treat more precisely with every passing year. We've gone from a single blunt question, where is it, to a richer one: what is broken inside it, and what exactly will shut that down? The progress is real, and it's uneven, spectacular for some cancers, still painfully slow for others, and the science is moving faster than ever. Whether you're a patient, a caregiver, or just someone who wants to understand the disease that touches nearly every family, that understanding is genuinely the best defense any of us has. Thanks for watching this series. And as always, this is educational, not medical advice.